Pancreatic cancer is a very aggressive cancer. This is seen in elderly people, generally 50 and 60 years of age. Men are more commonly affected than women. Pancreatic cancer, just like most other cancers, is diagnosed in advanced stages because most of the patients having pancreatic cancer have very trivial or no symptoms of the cancer is very early stages. By the time they develop symptoms, the cancer is very advanced. So let us see what are the risk factors for pancreatic cancer. Smoking tobacco. Tobacco usage is one of the most important risk factors for pancreatic cancer. Consuming alcohol, obesity, and patients with family history of pancreatic cancer and those who are having chronic pancreatitis. Chronic pancreatitis increases the risk of pancreatic cancer. As I mentioned before, pancreatic cancer has very minimal symptoms in the early stages. Just like any other cancer, the cancer starts in the pancreas, invades the adjacent organs, and later spreads to the lymph nodes and the distant organs. This is how a pancreatic cancer spreads. Pancreas is a very important digestive organ in the body. The pancreas has a head region and the uncinate process, the body and tail region. Symptoms of pancreatic cancer depend on where the cancer arises. Patients with head of the pancreatic cancer may present differently. The patients having cancers in the uncinate process or the body and tail region, they have different kind of symptoms. The most common symptoms are vague upper abdominal pain. The pain is very vague and most of the patients ignore this kind of pain. The pain is not very severe and the pain is very dull aching pain, very mild pain. They tend to ignore the symptom. They tend to ignore the pain and they take over the counter medications. This is how the diagnosis gets missed. Jaundice. Jaundice is yet another important symptom. Patients having cancer in the head of the pancreas alone develop jaundice. Patients having the head of the pancreas cancers develop jaundice because the tumor starts invading the bile duct and causes blockage of the bile duct and they develop something called as surgical jaundice. Patients who are having tumors in the body and tail region or the uncinate process, they may not develop jaundice at all. Unexplained weight loss is a symptom of cancer. It is very often seen in patients with pancreatic cancer that they have unexplained weight loss, and most of the patients say that they have lost significant weight in last few months. Again, loss of appetite, they have decreased appetite. Patients with cancer, the appetite decreases. New onset diabetes and worsening of the pre-existing diabetes could point towards a pancreatic cancer. These are the few symptoms of pancreatic cancer. Diagnosis, how to diagnose? So when you have these symptoms of pancreatic cancer, the most common test we do is a CT scan of the abdomen, a contrast enhanced CT scan with the pancreas protocol, a multi-phase scan. A CT scan is often diagnostic of pancreatic cancer. CT scan gives many details like the size of the tumor, which are the structures it is invading into. The main important thing is the blood vessels close to the pancreatic head, whether these are involved or not, and if the cancer has spread to other organs in the abdomen. All these details, whether the cancer is operable or not, whether we can resect the cancer or not, all these details are given by the CT scan. It also tells where the tumor is located, whether it is in the head of the pancreas, uncinate process of the pancreas, or it is in the body and tail region of the pancreas. A whole body PET scan is advised to most patients to see if the cancer is spread to distant organs. A PET scan is very important in the diagnosis and treatment of pancreatic cancer. Some tumor markers like carcinoembryonic antigen and CA19-9 are routinely done to see and prognosticate these cancers. So coming to the treatment. Treatment is according to the stage of the cancer. If the pancreatic cancer is operable and resectable, then surgery is the mainstay. If there are no metastases, if the cancer is operable, then surgery is the best and the only mainstay treatment of pancreatic cancer. So patients having head and uncinate process of the pancreas cancers, they undergo something called as Whipple's pancreaticoduodenectomy. And patients who are having body and tail region pancreatic cancers, they undergo something called as distal pancreaticosplenectomy, radical distal pancreaticosplenectomy. Following this, the patient will receive systemic chemotherapy. Patients who are having inoperable cancers, borderline resectable cancers, these are the patients who need neoadjuvant chemoradiotherapy followed by surgery if the cancer becomes operable. Some patients present in advanced stage, a stage 4 cancer, when the tumor has spread to distant organs. These are the patients whom we treat with systemic chemotherapy. Surgery has no role in these patients because these patients cannot be cured by surgery. So we give systemic chemotherapy for these patients and targeted biologics for these patients. Some patients with advanced cancer and jaundice need endoscopic biliary stenting, a metallic endoscopic biliary stenting to relieve the jaundice so that we can give chemotherapy. Patients who are having gastric outlet obstruction because the tumor causes blockage of the stomach. These are the patients who need gastric stenting, endoscopic gastric stenting, or a gastrojejunostomy, a bypass procedure so that these patients can eat food. So when they are obstructed, they cannot eat food, they vomit. So these are the patients who need a palliative treatment, a bypass or a gastric stenting so that they can eat food. My name is Dr. Dattaram. I'm a consultant surgical gastroenterologist and a hepatobiliary pancreatic surgeon practicing in Hyderabad. If you like this content, please like, share, and subscribe. We will come up with much more interesting topics like this. Thank you so much.